Welcome to our broadcast, The Path to Be Well, Knowledge and Learning Session. To all our listeners, we're so happy that you've joined us. And please note that you can also subscribe on our YouTube channel or find us on weedwell.live. These sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity to help you make informed decisions with respect to improving your quality of life. So now you may know someone that could benefit from this type of information. So please do us and them a favor by sharing this event. Hello, my name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded it just wasn't for me. I will admit I did find myself judging those who did consume marijuana, thinking their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. And after many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open and my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Now, having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one size fits all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So joining me today is Corey, and Corey has an amazing story to share that I am sure that our audience will appreciate hearing and perhaps even learning from. So Corey, welcome.
Yes, thank you for having me.
Yeah, Corey, as I mentioned to you a few days ago, is that we have observed over time that many patients that eventually find their way to us for help with cannabis and treating their conditions, it's not unusual that they've been kind of sitting on the fence for some time. Yet when we ask them, what prompted you? What was the trigger for you to make the decision and then make the call to seek help and guidance? And most times it is, I was speaking with someone and I could relate to their story. It seemed very similar to mine in so many ways. And if it, helped them, why wouldn't it help me? So Corey, I know that your amazing story is going to not only reach to many listeners, but I'm sure will resonate with them. And I'd like to know at this point, Corey, tell me, what was a day in the life of Corey prior to the introduction of cannabis and being under the care of medical professionals with cannabis?
Well, my life was quite difficult with sleep disorders and social anxiety. It impeded me from doing the things I wanted to do, such as going to stores or as simple as eating in a restaurant. It was just so difficult for me to just be able to do anything out in the public. It was really hard for my anxiety to allow me to do basically anything. I couldn't do training with my dog, and a whole bunch of other things.
So, what prompted you, Corey, to take the initiative and take that step? In this case, reaching out to us. What was the trigger?
Well, the trigger to basically reaching out to you guys was I first heard of Simcoe Holistic Health. And basically, I was intrigued in basically finding an alternative way of medicine, which really caught my eye. So basically, after that, I talked to some other people that I knew was in the medical cannabis realm, and then I decided that it would be in my best interest to come in contact with you guys.
So, we appreciate you doing that. I remember that day when you walked in very vividly, and I have certainly seen significant improvement. Um, yeah, huge, actually. So, since introducing cannabis to your treatment plan, how has that impacted your life? What things can you do today that maybe you weren't able to do prior to?
Well, it is night and day. I found when I found medical marijuana for that worked for me. I made uh, a big difference knowing where I was getting it and also the quality I was getting. And not only that, I always felt comfortable talking to the staff and doctors that made me feel that I was pursuing something that was the right treatment for me. So after my first meeting, I really decided that it was a route that I was willing to take, and it was something I was open to. And then basically, from the time I got out and was able to participate in the public, I was able to do more things that at one point I wouldn't have been able to do.
Hmm. And that's great to hear. So tell me a little rather about the journey. So often patients tell us, I needed support. I needed someone, a loved one, someone that is close to me, whether that be a friend or a family member. Um, what was that like for you? Did you take this on your own, or did you have someone really supporting you in the background, so to speak?
Oh, I had quite a lot of family and friend support on basically uh, the medical cannabis. Um, and there was a lot of internal support from the doctors and the staff that worked with me as well. So it felt like all around a good scenario for me to continue with using medical marijuana.
Yeah, well, that's awesome to have that level of support. Often we hear where because of this stigma, not so much today since deregulation of cannabis and being able to acquire it for recreational purposes, the stigma seems to have somewhat lifted. But as recent as a few years ago, that stigma was definitely there, and that is often one contributing factor for those considering cannabis as a treatment option for deciding not to or postponing that. but obviously that didn't seem to be the case with you and those supporting you.
Yeah, well, when I talk about the stigma, it definitely was there. And in a way, it is still there. Um, we are definitely night and day from where we were in the whole recreational and even medical marijuana terms of not being as stigmatized, but it still has, we still have a long way to go.
And I would agree, absolutely. Um, are you open and willing to share about what your treatment looks like? How did you start? Um, was it dry? Was it vaping? Was it smoking a joint or otherwise? Was it extracts? Can you tell us a little about how you started and the evolution and kind of where you're at today?
Well, it started very small. So I was talking to the doctor and other staff members, and we came up with an individual health plan, which uh, in the medical terms doesn't happen too often. So basically, we decided that we were going to start off very small, and then we were going to go into more doses if needed. And I started off really, really small with just a couple points and very little THC, mostly CBD, um, at my very beginning of my treatment, which didn't necessarily work for me at the time. Also, I was smoking it and I was using uh, extract of an oil which you can either put into baking goods or you can put it under your tongue or turn it into a capsule. So I was using that to help me sleep at night. And basically, as time progressed, I have gone to different LPs and producers to find basically the product and the treatment plan that worked for me. And over the couple years of doing it, I have come to uh, an LP that works for me and which has the products that I need. I still smoke and use the oil to help me sleep. And like I said, it's been night and day since I've started using these products.
Well, really exciting and pleased to hear the outcome. But correct me if I'm wrong, but I believe you said initially there was little positive coming out of it. Is that correct?
Yeah,
Okay. So then from that, I can only conclude that it wasn't like popping a pill and everything is gone and you're 100% better. It was a gradual process. And if you
yes.
agree, can you elaborate on that?
So basically, a lot of people think it's one uh, fit all, and it's not. There are lots of different ways to ingest it, as such as vaporizing, edibles. There is just smoking it, and there's extracts and a whole bunch of different ways to ingest cannabis nowadays. Uh, but when you sit down and figure out what works best for you, and basically when you decide on whether or not it is a suitable option for you, because again, it is not for everybody. A lot of people uh, can get either positive or negative side effects from the use of cannabis. And basically, from there, a lot of people have to uh, either decide if it's an option they're willing to take, and sometimes it doesn't work.
So, Corey, I applaud you for staying the course.
Yeah.
It's not, and for some patients, it can be within days that they start feeling significant results. And in some cases, that is not the way. So, from your perspective, you never gave up. You continued down the path. And I really like the approach that you've taken is exploring different methods and what was working best for you. Along with that, presumably different strains, even different licensed producers. And for those that are not from Canada, our licensed producers are the cultivators that are regulated, in our case, by Health Canada. So that Corey and all clients would be assured of a quality product. So you've done a lot of, call it experimenting. Um, how did you keep track of it all?
Well, originally I kept it in a journal to see whether or not I had positive or negative effects to the strain. And there were some strains that gave me negative, that increased my appetite, or that made me too sleepy or sedated me too much. So, like I said, there are negative side effects to using cannabis. But then once you find a strain or a way to use it that works for you, you will, like I said, if it is an option for you, you will at some point realize that it was worth the work.
Yeah, worth the work, and that is so true. And more patients that we have these types of consultations or interviews with, that is a common theme: is journaling to keep track. But you need to put in the work. You need to put in the time, and that's always easier with a support system that is definitely beneficial. But it's not, I've used this term often, but it's not like you have hunger pains and you go to a drive-through a restaurant of your choice and then you satisfy that hunger pain. It's a process. And like you, Corey, we need to be, and this is what patients are discovering, and we encourage that you need to become an advocate for your own health. You need to recognize where you're at, where you've been, and you know, and give some good thought to where you would like to be and take ownership of that, because it's not going to fall down from the sky or just be handed to a client on the silver platter. And you're a really good example of that. Does that make sense?
Yes, it does. And like I said, if you decide to put in the work, it can be life changing.
And you're living proof of that. The difference from the first time you and I met to what I see today, even Corey, even your ability and desire to be able to sit in front of a camera and have this conversation. Correct me if I'm wrong, but a couple of years ago, that may not have happened.
I can guarantee it wouldn't have happened a couple years ago.
Mm-hmm.
So that just shows how much my life has changed and how much I really believe in being an advocate for medical marijuana.
Mm-hmm. Now, Corey, so what sort of impact would your treatment results, what sort of impact would this have had to those who are near and dear to you? So those living in the same household as you, or friends and family that you are with, putting COVID aside, on a regular basis. What sort of impact has this had with those relationships?
Well, basically, it has had nothing but a positive. Um, I have been more social with my family and friends. Not only that, when things don't work out the way I want, I'm a lot calmer. I don't tend to have as much anger, and I'm able to process through my anger a lot easier, seeing that I have found the right strains and consumption of cannabis for me. And like I said, it has had nothing but positives for my relationships with my friends and family.
That's awesome. Um, so, Corey, I recall when you and I spoke a couple of days ago that you said I'm not sure exactly how you worded it, but basically the desire of your heart was to be an advocate and really promote the benefits of medical cannabis based on the impact that's had on your life. And here you are today. Um, Congratulations, because not only is this during this half hour, but as I mentioned to you, some people will be watching this in the upcoming number of days. And then we convert these video files to podcasts. So the message, the story, the journey that you've shared with me and our listeners today, you're reaching a whole bunch of people. I didn't want to dwell on that too much up front so that you
Yeah.
get stage fright, but that's the reality of it. So again, success, and I applaud you for that. You did it, and congratulations for that.
Yeah. Thank you so much.
Mhm. So Corey, as we approach wrapping this up, again, I cannot thank you enough for your willingness to do this, because I know without a shadow of a doubt that it does help those who hear it. And if not for them, they may know of a loved one and share that link with them so that they can, listen to your story, be inspired by it, and be able to make, decisions and choices for themselves. I also want to take this time and please pass this along to all of those that have supported you in your journey and encourage you where maybe at times you were discouraged by it. So please, pass our thanks and gratitude for helping you in your journey, and look at the results of it. Absolutely amazing. So closing comments from you, Corey, at this point.
Well, my closing comments are, again, I want to state that medical cannabis is not for everybody, but if it is for you, it can be life changing. And I just want to say that it doesn't hurt just to look at it, and just to ask some questions and to talk to people and see what and if it is an option for you.
Very good, Corey. Again, thank you so much. And I look forward to speaking with you in the very near future. And again, don't forget to thank all of those that have supported you and encouraged you in your journey. So enjoy the rest of your day. Bye-bye.
Bye.
Wow, what a great story and testimony. So as I wrap up, I'd like to remind our audience that these information sessions are intended for individuals who are in generally good health, are generally well-adjusted, and are functioning effectively, and are not in need necessarily of medical treatment, including mental health disorders. So these information sessions do not involve the diagnosis or treatment of any medical or mental disorders, and does not prevent, cure, or treat any mental disorder or medical disease. Further, these sessions are not a substitute for therapy, counseling, or even psychoanalysis or medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. And for those of you who have taken some steps in improving your quality of life, congratulations. Remember, your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be proud of the progress that you are making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of our team, those behind the scenes, we look forward to the next time that you join us. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.